This is a short presentation on enhancing student engagement in higher education, promoting student mental health, autonomous and individual learning. Hello, I'm Lisa Ann O'Donnell, a radiographer with 20 years experience in the clinical setting, and I've also had the privilege of working at Glasgow Caledonian University as a seconded member of staff for over 2 years. To start, I had looked at the reasons for the decline in engagement from students post-pandemic. This included the following: remote learning challenges, the mental health impact, the lack of extracurricular activities, both at home and at university, fatigue and burnout, a lack of individualised support, and economic and financial stress. As a university and as a member of staff, I then started looking at what we could do to improve this, concentrating on these which I'll discuss further, including providing mental health support, developing individualised learning plans, and encouraging autonomy. Why do we need to improve student engagement in diagnostic imaging? Well, we know the following is true, that there's an enhanced learning experience for engaged students. They're more likely to actively participate in class and ask questions. They're more likely to seek out additional resources to deepen their understanding of the subject matter. This helps them retain information and fosters critical thinking skills. There's increased motivation and retention. Students who feel connected and involved in their course are more likely to stay motivated and complete their degree programmes and succeed academically. This can reduce attrition rates and improve overall student retention. There's the development of professional competencies. So students who are engaged in their learning processes, particularly in HP courses, this helps them develop their critical skills, communication, teamwork and problem solving, which are essential for their future careers. This can lead to better clinical outcomes because AHP students are more likely to apply the knowledge and skills learned during their education to real-world settings. This can result in better patient care and improved health outcomes, which ultimately benefits society as a whole. It improves career readiness and employability if they're engaged or more likely to be well prepared for their professional roles upon graduation. They can develop the necessary skills and attributes, and that makes them more attractive to potential employers, which reflects well on the university. Networking and collaboration. The engaged student can foster a sense of community and camaraderie among students, and this helps them build relationships to enable them to collaborate well with peers, faculty, and professionals in their field, and that can contribute to their overall development and success. And lastly, personal growth and satisfaction. Engaged students tend to experience higher levels of personal satisfaction, self-confidence, and emotional well-being. If they take pride in their accomplishments, they are more likely to maintain a lifelong commitment to learning and professional growth. In summary, improving student engagement in universities, particularly in HP courses like diagnostic imaging, is vital for the success of students, the quality of healthcare services, and the overall well-being of society. By addressing factors such as mental health support and individualised learning plans, the university can foster a more positive and effective learning environment for their students. A brief mention of the mental health support. The younger demographic, which constitutes a significant proportion of the student intake, was disproportionately affected by the pandemic, as can be seen by some of the graphs on the left-hand side of the page here. Glasgow Caledonian University takes pride in its exceptional mental health support system, which is widely recognised for its accessibility and availability to students. The university offers a comprehensive range of resources, including a dedicated student wellbeing team, experienced counsellors, and various initiatives that promote positive mental health and wellbeing across the campus community. It is crucial for a lecturer to possess a thorough understanding of the mental health services available at the university and be adept at directing students towards these resources. Equally important is the ability to establish trust and rapport with students, creating an environment where they feel comfortable discussing their concerns and seeking support. This approach ultimately fosters a sense of confidence in the students, encouraging them to openly communicate their needs and challenges, allowing them to engage better with the university and their learning, something which I feel I'm quite adept at. A very brief look at individualised learning plans. These have gained popularity in recent years at university level, incorporating digital and artificial intelligence tools to provide a new pedagogical approach to learning. This combines individual learning plans with adaptive learning. One could look a little bit like this for a first-year diagnostic. There would be the initial assessment and goal setting, developing individualised learning strategies, course content and expectations, regular feedback and progress monitoring, clinical experience and hands-on learning, time management and study schedule, and professional development. All of which are actually carried out at a reasonable level at Glasgow Caledonian University. However, these could perhaps be expanded. By implementing a personalised learning plan, diagnostic radiography students can take an active role in their education, address their unique needs and set themselves up for success in their academic and professional careers. There would be a significant outlay at first, depending on the complexity of the personalised learning plan and the individual student's needs. The workload should decrease as students become more autonomous and confident in managing their learning. It is noted that there are additional benefits in this style of teaching for students who are neurodivergent. Implementing individualised learning plans can significantly enhance retention rates among these students by promoting autonomy and self-directed learning within their educational setting. These plans not only cater to the unique needs and strengths of each student, but also empower them to take ownership of their learning, fostering a sense of confidence, motivation, and overall academic success. To know what students' perceptions of what improves their engagement, a small study was carried out on occupational therapy students, and they were described as the top 3 most useful parts in the table below. Instructors who are approachable, learning through real-world activities, and notes and slideshows provided ahead of the presentation. These are carried out by Glasgow Caledonian University at the moment, utilising the X-ray suites and ultrasounds, plus placement and the use of interesting guest lectures. A notable finding of this small-scale study indicated that an instructor or lecturer's approachability played a pivotal role in facilitating student engagement and success. This particular attribute aligns with my own strengths, as evidenced by the multiple student award nominations I've received in the past, which highlights my commitment to fostering a supportive and engaging learning environment for all. In conclusion, students have struggled with engagement post-pandemic. GCU provides excellent support services which lecturers like myself must be aware of. To improve engagement further, a more individual approach to learning could be encouraged, utilising AI to design adaptive learning plans to increase autonomy among students. This may be particularly useful for neurodivergent students. The most important way of improving student engagement, however, is by having approachable, knowledgeable staff. Thank you for listening. A list of references.